Welcome back to the Liberating Generations podcast. I'm Dr. Keesha Ewers, and this is my beautiful daughter, Regan Claire. In this episode, we're going to explore the relationship between generational and personal trauma and Lyme disease and its many comorbidities.
Dr. Darin Ingels is a licensed naturopathic doctor and fellow with the American Academy of Environmental Medicine. He has more than 26 years of experience as a clinical microbiologist and practicing clinician, working with patients with Lyme disease, autism, and other immune disorders.
Welcome to the show, Dr.
Welcome. Thank you so much for being here.
Oh, my absolute pleasure. Thank you for having me.
So you and I've spoken a lot on summits, and you, as we said in the intro, work a lot with people with Lyme disease, autism, and other autoimmune disorders. And one of the things that science tells us is there actually is a link in how we express viral infections, bacterial infections, genetic expression in relationship to trauma, whether it's personal or intergenerational. And we always start out our episodes with asking our host, like, what their experiences with this. It's kind of a big subject nowadays.
Well, my medical history is that, I had Lyme disease back in 2002. I got bit by a tick literally 2 weeks before I opened my own business, and it really was the perfect storm. I think the timing, and of course, again, for anyone who's ever run their own business, they know what it's like when you're trying to get open. It's just there's a lot of stress, there's a lot of deadlines. And, I had acute Lyme disease. I got treated within a matter of days. And within even a handful of days of treatment, I felt really quite well. But, going into that schedule of working, 7 days a week, 8, 10, 12, 14 hours a day, 8 months into that schedule, I relapsed and then really struggled to kind of get my health back. And the long and short of it is it took me about 3 years to recover after that point. And then fast forward 10 years later, I developed an autoimmune disease. I developed multiple sclerosis. So, I think it's one of those things as again, I kind of look back and again, you and I have talked about this a lot in previous talks about the role of, particularly early childhood trauma. And I think it's so easy for anyone dealing with really any chronic illness to focus so much on sort of the acute stuff. We forget about all the stuff that kind of led up to that point. And you and I both know, and I know we preach it when we talk publicly and with our patients that, the terrain is so important. And again, it's easy to talk about the biochemistry of the terrain. This is the right food you should be eating. You should be sleeping X number of hours. You need to move your body. But the one piece that gets missed so frequently is that big T, little t, the trauma piece. And again, going back in my history, I moved almost every 2 years as a child. And it was the constant being the new kid on the block, having to adapt to, I literally lived all over the country. So if you've traveled this country, it's like being in different countries. When I lived in the South, I lived in the Midwest, I lived on the West Coast. And it's culturally very different in that constant need to have to adjust the way that you are, the way that you interact with other people, the way you talk. I realized that that was a really big stressor in my life. And, as a kid, I realized, my adult brain thinking about it now is not the way my child brain thought about it at the time. I can rationalize a lot of it now. It's like, hey, look, my family moved because my father took different jobs. It was necessary to put food on the table and provide for his family. And as an adult, I'm like, that makes complete sense. But as a child, it was heartbreaking. It was really difficult. And of course, the older you get, the more challenging it is. And just when you start to get that close group, close knit group of friends, now you got to move on, start all over again. And, I went to 3 high schools. I went to 2 middle schools and numerous grade schools. And I think that was the first thing that I can identify as being, uh, we'll say, unresolved trauma because you just kind of keep moving forward in life and you don't look backwards. It is what it is. But, having Lyme disease was one thing. It's like, okay, well, it's an infection. I was really stressed at the time. Again, I can rationalize it. But then when MS came along a decade later, I'm like, wait a second, this isn't just, I think Lyme did not help. I think it certainly set the stage for everything else that already gone on. But, I've also done a lot of reading of someone like, Donna Jackson Naquizada that talks about adverse childhood events and Louise Hay and how emotions get rolled into, illness. And, it's not rocket science to figure out that this is at least, I know, part of my journey. And it's something that I've, been continuing to work on, trying to move through because, if we can't get past that trauma, I think it's just very hard for the body to heal the way it's designed to heal.
I appreciate you sharing that, right?
Yeah.
This is because, the thing of it is that if you do look at the work that you just cited and you look at the adverse childhood experiences study, this big study that, is the largest of its kind, looking at the link between early childhood adverse events and current adult health and genetic expression, moving frequently is not on that list. And this is where I think people get a little derailed because there are many traumas that we go through in childhood that don't make the books. They don't make the psychology books. They're not part of a DSM-5 diagnostic criteria list. They aren't considered a capital T trauma. I'm a Navy brat from childhood. Same thing. My nervous system went directly into resonating with your experience as a child because I had the exact same experience. And I know that hypervigilance that comes up every time you have to enter a classroom, as a new kid is profound. Watching, my child self go into a lunchroom every time I'm a new kid and not even know which table is going to be the one that I
Right.
sit at, and there's just definitely a pecking order there. And when you're new, you don't know what it is. And it's very scary. But again, it's not considered a capital T trauma. So, that's what's so fascinating. I think people right now in the discussion of trauma informed therapy, we're missing the boat if we only identify capital T traumas as sexual abuse, domestic violence, emotional neglect, psychological, spiritual abuse. These that were listed in the ACEs study. Yeah.
Right. Yeah, and I know for myself, I mean, I never, as far as I can tell, had the big T. It was all the little T. And it's interesting is I've gone through some of my own trauma work. I think about specific events that happen. Like just an example. I mean, I lived in Louisville, Kentucky, which is generally considered the South, and I moved to Chicago, which is not the South. And if anyone's ever traveled to another place where they speak differently, if you stay there long enough, you'll find you start talking like them. It's
Yes.
accidental. Your subconscious goes. And so I kind of, moved up to Chicago with a little bit of a Southern drawl. And I can just remember, some of the kids laughing. And it's like, where are you from? And I'm thinking, I came from Louisville, Kentucky. Of course, I said it with a Southern accent, but, that little
Louisville.
thing of, well, yeah, Louisville. It's Louisville. Now, when I live in Louisville, and, but it's something as simple as that. I just remember being so profound. It's like I'm being judged for the way I talk. I'm already now the weird kid because he talks funny. I can remember them making fun of me because I came from a school that was actually an outdoor school, even though it snowed and was cold in Kentucky. And I had my outdoor jacket on. Well, in Chicago, everything's really cold. So all the schools are indoors. So, you put your jacket in your locker and you don't have your jacket on. It was my first day of school. I didn't know anything. And, people were making fun of the fact that I had a jacket on, like a winter jacket. These little things. But it's just being my first day of school. I'm like, it's like hit, 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 hit. You want to crawl under a shell and never go back to that school. And I'm like, I haven't even met anybody yet.
Yeah.
And, little things like that, again, over time, I think they just kind of add on your psyche. They weigh on you. And it's just those little changes in how you perceive yourself, how you perceive yourself in the world.
Yeah.
It just kind of makes you question all these things about you. And on top of that, let's be honest. I mean, kids can be cruel. They can be really mean. They can be really harsh. Sometimes it's intentional and sometimes it's not. But, especially I think that middle school, high school age group, again, where these kids have now often been together since they started, since kindergarten, they've known each other the whole life. And again, coming in as the outsider, it takes a little bit of time just for them to get to know you and kind of work into whatever group you're going to eventually, click with. I mean, I was fortunate in many ways that I was an athlete, so I was always on a sports team and inevitably had a team to kind of bond with. So, it never really took me that long to get integrated, but again, I can just think of those, few experiences that, still kind of have this profound effect. And I still think about them. I'm like, wow, it's like, you think it just kind of got buried somewhere deep in your mind, but it's still there. We're working on it. But I think, those kind of things have played a role into what has happened to me now.
Yeah.
Mm. Yeah, I don't think there's any person who goes into adulthood and says that they got out of their middle school and high school years without some form of trauma. Like
Exactly.
every single person I talk to says you couldn't pay me enough money to go back to that stage of life.
I
And
call it Dante's forgotten ring of hell, middle school. Yeah. You left one out,
absolutely,
Dante.
absolutely.
Middle school.
I'm heading back down to chiropractic school in a couple of months now, and I was just having a memory of my middle school days this morning, of how I would avoid the lunchroom by going to the library and getting all of my homework done, and then I would go to rehearsal after school, and that's how I would avoid all of the hierarchy and the cliques that form in middle and high school, but I mean, even into adulthood. So yeah, thank you so much for sharing that story. I absolutely could resonate with that.
Well, I don't think it helped. I mean, I wouldn't say I was a huge nerd, but I mean, I was a good academic. Again, I was also an athlete,
Mm,
but yeah, again, being judged for, doing well. I can remember when I went to high school. So I I had moved from Chicago to Southern California. I was a sophomore in high school, and I went to one high school very briefly, and it was horrible. It was a brand new public school, and they had a lot of problems. I ended up transferring to a smaller private school,
mm,
but I ended up, because it was a small school, I ended up knocking off one of the guys off the basketball team. I was just better than he was.
mhm,
And it created so much conflict because not only was now he mad at me because I took his spot, but now all his friends were mad because I took his spot. And, I went to high school with 72 kids in my class. So, there wasn't a lot of, I guess, suppose if you go to a bigger school, you kind of just get lost in the sea of people. But in a small school, that doesn't happen. And
mm,
everybody knows everything about each other's business. And again, it was just another, conflict that as a kid, you're trying to overcome and navigate. And, I don't remember having a lot of conversations with my parents. And it's not that they didn't care or they probably asked, but I think it's also, it's awkward as a teen to share sometimes those feelings with your adult parents and or really any other adult because you don't think they really understand and they're not going to get it and they don't have to live in my shoes and you
mm,
can sort of rationalize why you don't talk about it. Again, in
mhm,
retrospect, I kind of wish I did. I'm sure my parents, because they were kids once too, right? I'm sure they went through their own middle
Teenagers
school and high
forget
school.
that little item.
I know. Yeah, what's really funny though is my parents are actually very young. My parents got married at 20. They had my brother at 21, me at 22. So, at the time I was in high school, I mean, my parents were in their, early 40s, late
Mhm.
30s,
mm,
early 40s. So they really weren't that far removed from their high school days.
mhm,
But yeah, I don't ever remember really talking with them about it. But I get it. Wish I could. I would encourage certainly any young person who might be listening to this if that's happening, reach out to your parents. They love you, they care about you, they really want what's best for you, and they have a lot of wisdom. You don't
Mhm.
recognize it as a kid, but they know a lot more than they think, and they can probably give you some really good advice on helping navigate stuff like that.
Yeah, it's
yeah,
true.
mhm,
Right, mom?
yeah. Very true.
So I want to come back to the tick. You mentioned when you got out of medical school and then you were starting your own business, you got bitten by a tick. And we've set the stage for the ecosystem the tick entered.
Mm,
And I want to make that clear because
mhm,
a lot of people get bitten by ticks. I've had
Right.
Lyme disease also. And different people will respond differently to a line bearing tick. And I would like to invite you to talk a little bit about that. Like, why does one person have a response that's so dramatic and another one with a bullseye in the whole bit moves right on?
mm,
Again, I think it all comes down to the terrain. I
Mhm.
think there's all the things that lead up to that tick bite, again, that set the stage. So it's, your diet, it's toxicity,
mhm,
it's sleep, it's how much you move your body. It's all the things that affect you down to your cellular level. And again, we could say, we're talking about Lyme disease, but this applies, I think, to any chronic infectious agent. I think COVID was a great example of that. Why did we see some people get no symptoms, some people got a sniffle, and some people died? What was the difference? If we agree that it was relatively the same virus, I'm like, yes, it did mutate over time, but at any one time, it was kind of the same virus out there in the world.
Yeah.
And, the difference is the terrain.
Mhm.
So I think, again, I can just speak about my own experience, but again, I think when I started my own business, because I was so stressed, I was not sleeping well. I was not eating well. I was not exercising or moving my body. And I can look back again early in my life. I had a lot of toxicity. I mean, my father worked for an oil company. He worked for Arco. And I used to spend my summers in high school climbing inside oil tanks, cleaning them without a respirator, because that's just what you did. So I had all that kind of stuff. I mean, I worked as a microbiologist. I worked in a lab. I mean, we used to stick our hands in toluene and stuff without gloves just because that's what you did. So
Photochemicals here, Dad,
yeah,
photographer, just sticking those hands right in there. Yeah.
we just didn't think about it. We thought it was
Yeah.
safe. Nobody ever said, "Hey, you really can't do that. It's a bad idea." But when you are maybe when you're younger, maybe you're a bit healthier. I think your immune system's more resilient. As we get a little older, I think we naturally lose some of that resilience, and that toxicity, of course, accumulates over time. So being exposed as an 18 or 19-year-old, my toxic load really wasn't that high yet. But then being affected in my 40s, now that toxic burden had just increased over time. And so when we look at, the combination of all of that, you get that tick bite, and that's just the final, kick of the teeth, the straw that breaks the camel's back.
Yeah. And I think when we talk about ecosystem, and this just may be me, a lot of times people will flip into or terrain, uh, the terrain of the gut alone. And I want to expand the definition of terrain to what we're talking about is your genetics, right? Your nervous
Absolutely.
system, your cardiovascular system, as well as your endocrine system and your GI system, right? So we want to talk about this whole body as the terrain that a virus enters, via whatever it is, though, a droplet infection, Epstein-Barr through sharing a straw with somebody or kissing, and then the tick. So these are all areas that I think get put in separate categories. And I'd like to just invite everybody to expand that into it enters your body in some way and it enters your terrain, right?
Well, again, when I got bit by the tick, I had classic Lyme disease. I'm actually one of the few. I mean, I've treated over 8,000 Lyme patients at this point in my career. I'm one of probably less than two handfuls of people I've ever seen that had classic Lyme disease with the bullseye rash, headache, joint pain, fatigue, neuropathy. And I had all that. I had a big bullseye on the rash on the back of my left leg. And within 4 days of taking doxycycline, I mean, my symptoms were 100% gone. And of course, the standard treatment is, I think I was on Doxy for 3 weeks because that's what they recommend and that's what I knew. But again, it was the perfect storm leading up to that. I think had I not been starting my own business, I wasn't so stressed out, I would have been eating better, sleeping better. And like a lot of people, my immune system would have been capable of managing that on its own. I'm convinced if I tested everybody in New England and, probably 70% of people would show evidence that they've had exposure to Lyme disease. I mean, it's just that common, but they don't all actually
on the West Coast.
Yeah, exactly. And, all these people don't get Lyme disease.
Right.
So we know that a lot of people are having exposure. They just don't get sick. And again, what's the difference? Well, again, like you said, I think it's the whole body terrain. It's so easy to focus on the gut. Now, granted, a lot of people I work with have a lot of gut issues, and that's obviously important. We know that up to 80% of your immune function stems from the gut. So that's critical that we address that. But like I said, it's your cardiovascular health, your respiratory health, your skin, your brain, it's all of it. So, when we talk about helping your terrain improve, it's a head to toe analysis of what's going on and what your exposures are. And I'm glad you mentioned the genetics part too, because again, that often gets overlooked. Some of us are just genetically hosed. And
we are right here.
I'm right there with you.
Keep talking to two of them.
I mean, it's kind of funny. I work again with a lot of kids with autism, and you kind of would expect that they would have a lot of genetic defects because of the nature of how, they present. And I mean, I looked at my own genetic profile. I mean, it's worse than most kids I see that have autism. So again, it's not difficult to imagine that, when I get toxic exposure, when I get exposed to certain things, again, my body's ability to handle that probably isn't as good as it should be. And genetics are a big part of that. Thanks,
Mm-hmm.
mom. Thanks, dad.
I know, right?
Right.
And what's your gift of having hosed genetics?
Well, my body tells me everything. And so my gift is I can't ignore the signals my body's giving me. And so therefore I'm living a lifestyle that is leading the way for others. I'm paving the way for others. That's the way I'm choosing to look at it.
Yeah, I wish I was one of those people in some way. I mean, a lot of people, again, I see their genetics present such a way that they're hypersensitive to everything. They smell mold before other people. They
Yeah.
can feel things for other people, and I don't have that. I wish I did, because it would probably help me avoid a lot of situations and places that are probably not bad. I mean, most recently, I just found out I've been working out of an office that had terribly toxic mold, and probably for years.
Mm.
And again, having MS, a lot of these mycotoxins are extremely damaging to the myelin of your brain.
Mhm.
And other people in the office like, oh yeah, I kind of felt like I smelled something, I noticed something. I'm like, well, I wish you'd said something earlier, because by the time we found out, I mean, we evacuated as quickly as we could and pretty much threw out everything in our office.
Mm.
But I don't have that barometer to know necessarily that I'm having that kind of exposure. And I know some people, based on their genetics, they do have that hypersensitive piece where, again, they can smell, feel, have that perception of things that are making them sick, and
Mhm.
hopefully avoid those situations before it gets to a point where it makes them more toxic.
Yeah, I want to ask your advice on something actually, because you mentioned that you got Lyme when you were opening up your business. And I know obviously that's such a stressful time. And I think anyone who has tried to
I'm interrupting you for a second.
yeah.
You so rudely.
So
Because
what's
as
going
you
on?
say this, I want to also say, and let's not mention all the years of medical school and
And medical
boards.
school ahead of
And
time. Yeah.
then go ahead.
Yeah. So you've had years of schooling, you've done boards, you've put your immune system through a roller coaster, right? Like you've done a lot of stressful stuff leading up to just opening and doing the thing. So of course you're more susceptible to getting Lyme. And so yeah, I would like your kind of your advice on this as I go back down to school and I'm, gearing up for board part ones, twos, threes, fours, and then opening up my own practice. And I was at school for a year before taking a year off because I just destroyed myself. I absolutely destroyed myself. And so
Yeah.
I did have to take time away to really center in and really focus on self-care practices and meditation practices, which are my self-care practices. Really eating well, really moving my body every single day. And that takes a lot of time and a lot of intention. Like that's at least 2 to 3 hours a day of just really focusing in. And sometimes we don't have that ability. And so what I would like to know from you is if you could go back to that
Mm.
person who was starting your practice, what would you say to him? What would your advice be to him?
Probably don't do it.
Mm,
I would say that tongue in cheek. I mean, I'm glad I did. I would have done it, I think, differently.
mhm,
I think the way things unfolded, because I was actually working at another practice, and the practice went, unfortunately, south in a hurry. And I was left in a very awkward position that I had just moved from Seattle to Connecticut. I'd only been there a little over a year. I spent a lot of money relocating myself, and I was out of a job. And so I had a choice. I had to either figure out a way to stay, which really meant opening my own practice because there was no job opportunities of someone who was going to hire me, or move back home, go somewhere else. I mean, either way, I was going to be put in a position I'm going to have to come up with something new. And that was going to be stressful. I'm like, at least I'm here. So I spent 3 months sitting down, writing a business plan with, by the way, zero business experience.
mhm,
And I was fortunate to have connected with a group called SCORE. It's the Service Corps of Retired Executives, which is a free service anyway for anyone who wants to start a business. These are all people who are CEOs, COOs, accountants, lawyers for big businesses. And then when they retire, they give back. and teach you how to run a business. So they gave me a lot of guidance on getting started. But still, I mean, every week you're meeting with them and you're crunching your numbers and you're just trying to figure out how to get money when you have no money to even start a business. So it was 3 months again of really a lot of stress. And then I got the money. Well, now you got to get the practice open. So yeah, I mean, I guess going from medical school to residency to a practice that was really struggling when I moved out there, and there was a lot of conflict within the practice, to then all of a sudden have become a business owner with no business experience. It was a lot. I think
Mhm.
again, I'm not sure how it is in chiropractic school. In naturopathic school, we do not get a lot of good business advice. I mean,
No.
I think we technically have a business class, but it's not
Yep,
great.
that's us too. We have one
So,
business.
as
I
an
don't think any of the medical professions offer that.
no, so, and forget it, unlike a lot of, MDs and DOs, when they come out of, residency, there's a lot of job opportunities for them. So they can get hired by someone, get paid a good salary. But, for chiropractors and naturopaths and acupuncturists and other healthcare providers, that's often not the case. So I wish I had done more in school to prepare for the business side coming out. I think that would have alleviated a lot of stress if I had better guidance on kind of what I need to do. And I think about a lot of people I know now who did that. I mean, I know some people like while they were in school, they almost kind of like started their business before they were done. I mean, they weren't seeing patients doing that, but they had kind of started getting their feet wet, laying out that plan of what it's going to look like and already talking with people about, okay, hey, this is kind of what I want to do, helping, where can I get financing, whether I'm borrowing from family or friends or trying to go to a bank and get a loan. I think a lot of work could have been done earlier
Mhm.
that would have made life a lot easier. And during school, I mean, I laugh too. It's like, I think I was probably the most unhealthiest. I mean, here you go to naturopathic school, chiropractic school. I mean, we're like healthcare people. I mean, really healthcare people that
Yep.
we want to teach people how to be healthy. And the environment is so unhealthy
Ugh.
because it's long hours and studying and exams and labs and this and
Mhm.
that. And at Bastyr, I mean, yeah, my school day was often 8 in the morning till 6 at night.
Yep.
And then by the time you get done, eat dinner. Now you got to study, which is usually 3, 4 hours a night.
Mhm.
When do you have time to exercise and prepare good food and do all of the self-care things like you talk about? Again,
Mhm.
had I gone back and done it differently, I, uh, I think a lot of it's just about scheduling,
Mhm.
and you just really have to schedule that time in and make it a priority.
Mhm.
And I know how it is like with tests, and I don't know about you, I was like a terrible test anxiety person. I always did well, but I would have the anxiety anyway, and I
Uh-huh.
would stress out so much about it, like I'm gonna flunk a test. I'm like, I don't think I ever flunked a test a day in my life, but
Yeah.
that fear, right? I mean, this is gonna be the
Yeah.
first time. And so this need to overstudy, I'm like, I probably would have been more efficient if I had just gone out for a walk for an hour
Yeah.
and then sat down and studied after class. But I would go right from class to studying, and there was just like no break. I
Yeah.
mean, I did some stuff in between. Again, I could have done a much better job. And even eating, it's like, I did not eat very well. And again, I was broke during medical school. I got whatever money the government would give me to pay for tuition and my housing,
Mhm.
and there was very little left over for anything else. So I couldn't afford to buy good organic food. And I'm ashamed to say it, but I mean, I spent a lot of days at Costco for their $1.50 hot dog and Coke because it was cheap. And,
And
that's kind of,
caffeinated to keep you awake for your
Yep.
study.
yeah, and caffeinated. So it,
Yeah.
it was not ideal environment. And I know there's, for any kind of postgraduate education, there's always a lot they need to cram in that time frame.
Yeah.
And,
Get you ready for boards.
Yeah.
to get ready for boards. They want you to be successful. They want you, of course, yeah, pass your exams and get out there in the
Yeah.
world. But it's just so much information. And of course, you realize when you get out after the fact, it's like you're not going to learn everything you need to know in medical school. It's really a lot of it's teaching you where to go look things up, and
Mhm.
ultimately until you start getting out in practice, and hopefully you've got a residency or mentorship, that you can work with practitioners with a lot of experience. That's what's really going to help, grow your knowledge base. And I think we feel the need in school that we need to learn everything about medicine. And if we don't, we're gonna fail some patient when we get out. And it's
Mhm.
just not the reality. So there's a lot of this undue stress. Like, and I wish they would teach that in medical school that like, you're not gonna learn everything here, and that's okay.
Mhm.
But you know what? You're gonna know where to look it up. You're gonna know where to find the right resources to have the right answer. And I think that would have taken a lot of stress off of everybody in school.
Yeah. Thank you. Yeah. So what I'm hearing is even if it means failing a test or two, I think prioritizing that self-care is the most important thing. And I know I, for one, when I was at school, I had a really hard time doing that as well. Cause yeah, you're preaching to a fellow test anxiety
Same here.
gal. Yeah, I am.
So what I'm going to recap about that is to really who's sitting down to take the test.
Mhm.
Is it a smaller version of yourself, a child who is anxious about getting it right, right? And that person's not going to be able to retain all that information because they're going to be scared all the time. And your memory, like science tells us this, your memory operates differently when you are hypervigilantly wondering if you're going to survive.
Mhm.
You know, if the zebra is being chased by the lion, it's not paying attention to how the ground feels under its hooves, what the sky's color is, you know, the
Right.
different marks around. It's looking at survival on the horizon, and that is it.
Yeah.
And so your brain architecture changes in that state.
Mhm.
So if you're, you know, if you're one that has, if I pass, my worth is stable, and
Mhm.
if I fail, my worth goes down the toilet, then that one that's sitting down to take the test isn't going to be able to deal with the complexity that the adult brain can deal with. So it's
Now,
really tough.
well, and I think that ties in what we were talking about earlier. Again, I think being a new kid, when you perform well, that gives you worth.
Yeah.
And if your need in a new place is to feel something, if I
Mhm.
can at least feel that worth that I'm a good student and I
Right.
perform well, I've now shown that to my peers that I'm a smart. I've shown it to my parents.
Mhm.
And I never don't think I've ever flunked a test. Maybe I flunked one,
Mhm.
but it was not like a common thing. So there was no logical reason to feel that anxious about any test. And of
Mhm.
course, in medical school too, everything's graded relative to everybody else in your class. And so I mean, even when we took boards, it's like, have you ever been at the bottom of your class? I mean, if you have been consistently, okay, maybe you've got some legit concerns, but I mean, I was always at the top of my class. So there was no logical reason to feel anxiety. But I think a lot of it does stem from earlier in childhood of that need to perform, that need to please other people, the need
It's a
to
trauma response.
demonstrate that I have worth in this way.
Yeah.
Yeah.
I always say all the alphabet behind my name, which is a little weird. I have so many letters. It was trauma response. And it wasn't until I realized I was trying to fill this bucket that had a hole in the bottom of it for self esteem and self worth that I could finally put an end to it and say, oh, like
Mhm.
you don't have to be proving anything anymore.
Right.
It's not proving anything to anyone anyway. It's just burning you out.
Mhm.
So at the end of the day, is your bucket on flames from the inside out, then it's not serving anything.
I agree.
Mhm.
Yeah. Which is what MS, and for me it was rheumatoid arthritis. It's
Mhm.
right. We're attacking ourselves when we have autoimmune disease.
Mhm.
So that doesn't make good sense. When you're at war with yourself, there's no winner, right?
Yeah.
Absolutely.
Yeah. So do you have another question?
No, that was great. Thank you.
So you have run the Lyme Disease Summit. Yes. Okay.
Yes. So Dr. Tom Moorcroft and I, so Dr. Tom, you and Dr. Tom know each other as well. And he's also a former Lyme patient. So we are launching a Lyme Summit that will come out May 9th. That's next week and runs through the 16th. And we've invited 55 plus of really the top people out there in the Lyme world that talk about everything from different forms of treatment to management. And of course, we talk a lot about the effect of trauma and mental emotional aspects of Lyme disease. Again, like every chronic illness, there's so many complicated facets of the illness. There's just no one piece that kind of explains the totality of all of it. So I'm really excited we're able to bring all these different people together to share their experience and their knowledge. It's an absolutely free event for anybody. So we just encourage anyone who's been dealing with Lyme disease, or if you know anybody who's been dealing with Lyme, this is going to be a great opportunity again to hear from some of the top experts in the world. And for people who really like the content, we would love for people to buy the whole summit. We think it's going to be an incredibly valuable resource that you can go back to time and time again and have it as part of your library. And again, knowledge is power. So I think the
Yeah.
more that people understand about their illness and they can be proactive and get them to a state of better health.
Beautiful.
I just want to mention again, as you purchase the summit and you have it in your library, to realize, as Dr. Ingels has mentioned, that each person is individual. So you are an individual, and pay attention to that. Like, it's that, as that tick embedded, what did it turn on? Like, what was it interacting with in that terrain for you? And to really ask that question of yourself, where in functional medicine we call this antecedents and triggers for predisposing factors. What was already there that that little being arrived to? And what then was the key that turned that on? And what that then can help you reverse engineer how to back it away from the edge of the cliff. You don't have to have chronic Lyme disease, right? That can be reversed, which is the beauty of having this summit.
Well, I think, again, for any chronic illness, I think in most cases there's that possibility of reversing the illness. I know that's not necessarily what the conventional medical world preaches, but you and I have
Not
both had
all
the
what the conventional
experience.
medical world reaches.
I mean, you and I have both had the experience of having people with serious, chronic autoimmune issues, get back to a better state of health and they don't have their symptoms anymore. And I think that's the beauty of being human, right? It's built into our DNA to heal. We just need to clear these obstacles out of the way to allow that process to happen.
Yeah. My rheumatoid arthritis was reversed 25 years ago from getting at my trauma, and it hasn't been back since then. I still have the genetics for it. My grandfather had it.
Yeah.
Died in a wheelchair with it. So this is definitely, just because it's in your genetics, that doesn't mean that it needs to be the way that you express them. So I
Absolutely.
really encourage people to purchase this information from Dr. Ingels and Dr. Moorcroft, because it's just vital for reclaiming your health. Yeah. Thank you so
Beautiful.
much for being a guest on the podcast. It was
Thank you so much.
delightful to be
My
able to talk to you.
absolute pleasure. Thank you so much for having me.
All right, everyone. Until next time, be well.